Hi, my name is Johanna Martinez, and I'm going to be performing my head, ears, eyes, nose, and throat assessment on Brody. I'm going to perform some hand hygiene. Okay, and Brody is alert and oriented to person, place, and time. Um, he is not in any distress. I'm going to assess your head, Brody. Okay, so his head is round, normal, okay, symmetrical, even distribution of hair. I'm gonna assess the head for any masses or lesions, where there is none. Okay, hair is texture is curly. Pain or tenderness when I touch Brody? Any
No.
pain or tenderness? Good.
No.
Face is symmetric, no involuntary facial movements noted at this time. Let's check for your eyes. Cover one eye for me, Brody. And I want you to read this line, okay?
LTFPH.
Cover the other eye.
LTFPH.
Amazing. So we can say that Brody's visual acuity is 20/20, okay, bilaterally. I'm gonna put the chart there. And now, Brody, I'm going to check for direct and concentric pupillary light reflex. I'm going to turn off the light for this. Okay, I'm going to shine a light. I want you to look straight at the wall. Okay, and we're going to see for constriction of the pupil. Amazing. Good. So pupils constrict bilaterally. Now we're going to look for concentric constriction of the eye and the pupil. Perfect. So we have concentric pupillary reflex. Okay, I want you to look at my pen, Brody, and you're going to follow the pen. So eyes converge, okay, with no nystagmus or involuntary eye movements noted. You're gonna follow the pen. We're gonna check for the cardinal points, which are present. Okay, no involuntary movements noted. And he is able to follow adequately. Perfect. Okay, Brody, so now we are going to check. I want you to cover your eye, one eye, and you're going to tell me when you can see my hand. So can you see my hand?
No.
Okay.
I can see them. I can see them. I can see them.
Okay, you're going to cover the other eye.
I can see them.
Good.
I can see them.
Good.
I can see them.
Good. Excellent. So that was, we were testing your visual fields by confrontation. Okay, and now we're going to perform a fundoscopic exam by looking in the eye with this instrument, the otoscope. I'm going to darken the room a little more again. Okay, and we're going to look for the red reflex. We're going to look for the optical retinal vessels, optic disc within the eye. So from here, I can already see the red reflex, okay? Optic disc is present along with retinal vessels. No abnormalities noted within the eye. Red reflex is visualized. Along with optic disc and retinal vessels. Optic disc is present, macula. Okay, excellent. Thank you, Brody. So, sclera is white. I'm gonna turn on the light. Sclera is white. Pupils are present. Both irises are present bilaterally. Look up, Brody. Conjunctiva is pink. No redness, no exudate, no abnormal drainage coming out from the eyes, okay? Now we're going to move down to the nose. So in the nose, nose is symmetric. No deviations noticed. Septum is midline, okay? Any pain or tenderness, Brody? No. We're going to look inside the nose, I'm sorry. Okay, with this device. So there's no perforation, no swelling, no polyps, no drainage noted within the nostril. Nares are patent. Okay, and the other nair, no drainage, no swelling, no polyps, no erythema, no inflammation noted, and nair is patent. Excellent. Okay, now we're going to palpate for maxillary nodes, non-palpable, frontal, non-palpable. Any pain?
No.
Okay, good. So I'm gonna continue with the nodes. We're gonna do the pre-auricular, non-palpable, post-auricular, non-palpable, tonsillar, non-palpable, occipital node, non-palpable. We have the submandibular node, non-palpable, submental node, non-palpable. We have the supraclavicular node, non-palpable, the deep clavicular node, non-palpable. Any pain or tenderness when I touch?
No.
No, I want you to shrug your shoulder. And here we have the supraclavicular, non-palpable. Excellent, Brody. So I want to look now at the trachea. Trachea is midline, no deviation. Okay, and it's symmetric. So Brody, I'm gonna have you take a sip of water, and I'm gonna test for the thyroid gland. Okay, take a sip. Excellent. Thyroid was felt nice and smooth, no goiter, no mass, no swelling palpated when Brody swallowed. So I'm gonna look at your mouth. There's no swelling, no edema. Can you open your mouth for me? All teeth are present, no cavities. Gums are nice and pink. Mouth is nice and moist. Can you open your mouth big and say ah, ah? So uvula is midline, tonsils are present, non-swollen, okay, no exudate noted, no redness noted on the throat. You can close your mouth, okay. And now we're going to move on to the ears. So I'm going to stand behind you, and I want you to tell me, what do you hear?
99. Brody.
Can you hear this?
Yes.
What do you hear on this side? Good. And you hear it?
Yes.
Amazing. So hearing acuity is intact, okay, bilaterally for Brody. Okay, we're gonna perform the Weber and the Renee test, okay, with the tuning fork. So Brody, you're gonna tell me, where do you hear the sound the loudest? You're gonna tell me if you hear it the loudest on the bone, that's gonna be on the mastoid process, or in front of the ear, which is air conduction, okay? Do you hear it? Tell me when it stops.
I stop. I stop.
Okay, where do you hear the noise the loudest?
In the front of the ear.
Okay, so that's air conduction, which lets us know that there is air conduction is greater than bone conduction, which is a normal finding, and that means that there is no conductive hearing loss for Brody. And now we're gonna do the Weber test, okay? Do you hear it evenly in the center?
Yes.
Great. So hearing is intact for Brody. Now I'm going to assess your auricles, your ears, your tragus. Okay, any pain or tenderness?
No.
Okay, great. So tragus is within normal limits, and so is the auricle. And now I'm going to look inside the ear, Brody. Okay. So here we have no redness, a little wax. Tympanic membrane is present, no perforation, it's not red. Cone of light is 8 o'clock, and tympanic membrane is pearly gray. Okay, on this side of the ear, this is the left ear, we have tympanic membrane present, pearly gray, no redness, no discharge, no swelling noted. Okay, a little bit of wax. And the cone of light, it's 5 o'clock on the left ear for Brody. Okay, next we're going to assess the chest. So I'm going to ask you to take off your shirt, Brody. I'm going to listen to your lung sounds. I'm going to assess for tactile fremitus, right? So I want you to say 99.
99.
Say 99.
99.
99. Good. Brody is breathing normal, not labored. Okay. Equal rise and fall of the chest, right? He's not looking like he's in any distress when he breathes. I'm going to listen to his lungs. I want you to take a breath. Breathe, please. Take a deep breath, please. Thank you. Deep breath. Excellent. 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 I want you to turn to the side, please. Take a deep breath. Deep breath. Can you say 99?
99.
Say 99.
99.
Again?
99.
Okay, and I want you to whisper 99. Whisper 99. Again? Excellent. So here we did the whisper pectoraloquy, and we also checked for egophony, which sounds muffled, which tells us that there's no condensation on the lungs, right? There's no fluid buildup, and it is a normal finding. We want to hear muffled E at 99 when he says it, correct? Okay. So this concludes our assessment, but before we finish, I just want to assess the lungs. So we have some resonance on the top and a little bit of dullness on the bottom of the lung. Excellent. Resonance. Any pain?
No.
Good. Good. Excellent. Thank you for your time, Brody. This concludes our head, ears, eyes, nose, and throat assessment.